My name is Pat Coleman, and I am the director of the Cardiovascular Cath Lab and the co-director of the Transcatheter Aortic Valve and Structural Heart Program. I've spent a lot of time in cardiac medicine. I trained in the 80s and came here to Santa Rosa in 1992, and more recently have been involved in starting our structural disease program. Santa Rosa Memorial Hospital is the region's premier cardiovascular center, and that's because it offers a broad variety of cardiac services with experts in their field that have had a lot of training and a lot of time doing their job. We take care of the majority of heart attacks that come in either by ambulance, by helicopter, or they just come through the door 24/7, 365. And that's allowed us to become excellent and allowed us to become very proficient and efficient in terms of taking care of people.
I'm Dr. Ramsey Deek. I'm the co-director of the Structural Heart Program and the chief of cardiovascular surgery at Memorial since 2008. What makes this program remarkable is the fact that we have different teams coming together, cardiologists, cardiac surgeons, operating room nurses and staff, and bringing in their expertise and putting it together into one arena. The mission of this hospital is to provide the best care for people in this community without the need to travel to an academic center, for example. We've been very successful in attracting extremely talented physicians to provide that care.
I'm Atusa Malanazadeh. I'm really proud of my role as a structural heart coordinator and being part of the cardiac team because of the level of service that we provide, ensuring that we have the communication line open with their physicians and caretakers so that they can have that continuum of care. From the beginning of the process, we communicate with their physician, make sure that they know what's going on with the care of their patient. We want to be able to provide the same quality and excellence care for neighboring patients and patients coming to us from out of the area. To give you an example, we have a TAVR clinic where patients come for all their workup, and it's all scheduled for one day. This will allow patients to come from out of area and get everything they need to get done and see a surgeon all in one day as opposed to make multiple trips.
One of the great things about the St. Joseph's Health System is it is a regional program. We've got hospitals up and down the 101 corridor, and we coordinate care and communicate with all of the cardiologists and cardiovascular surgeons from those institutions. Everybody knows each other. We pick up the phone. We are all in the same computer system, so we can look and see what's happening in the computer. We know what the labs were from the patient's visit a week ago up in Eureka. So that kind of proximity and close communication and support really pays off in coordinated patient care. One of the most gratifying things in my cardiology career of 28 years has been starting programs that impact a huge cross-section of the local population, so you have the ability to impact not only individuals, but whole populations. So this has been a really rewarding part of my life and a really rewarding career in cardiology for me.